Welcome to the Health Channel, All Health All the Time. I'm Olga Villaverdi, coming to you from the Baptist Health South Florida studios. We have a very exciting show planned this hour because we're joined again by Dr. Alberto Sirven, obstetrician gynecologist at South Miami Hospital and West Kendall Baptist Hospital. And also joining us is Jeanette, I should say, Jeanette Janero, fitness expert, the owner of the Naked Formula, and recently a new mommy. Now, by the way, just to refresh your memory in case you didn't watch that show that day, but Jeanette was on our show with Dr. Sirven when she was 37 weeks pregnant. And as you can imagine, things have changed since then. Let's first take a look at some of the highlights from that show. Is it a boy or girl?
It's a boy.
And your first one is a
boy.
All right. So with your first pregnancy, how far did you take the pregnancy to? How many weeks?
37 weeks and about 3 or 4 days.
Oh, okay. So you made it to, a good amount of time. And you are 37 weeks today?
Yes. We could have a very exciting second half of the show.
I know. Wouldn't that be great, doctor? I mean, come on.
That would be interesting.
We'd be like, she's down here. We're doing good. Breathe. I'd be coaching her. Oh, that would be fantastic. What's the conversation you have with moms-to-be about that exercise while you're pregnant?
Well, I definitely encourage the patients to exercise. I mean, one thing great about her is that she was exercising prior to pregnancy. It's so important for patients to maintain that. But even those patients who do never exercise prior to pregnancy, I encourage them to especially do, if you never exercised before, you do walking. Another thing that I encourage significant here in South Florida is swimming, because swimming you could do through the whole pregnancy, and we have so many pools, and the ability is, and I tell them it's not a matter of just laying in the pool. Just do exercise, time yourself, swim a couple of laps, do something that makes a difference so you increase your heart rate, help your cardiovascular system significantly. So overall, I mean, it was great the fact that she was exercising prior to it and she kept it up. There's a lot of patients who once they get pregnant, they feel that they no longer should exercise. I think that's just so wrong.
So that was 2 weeks after, no, that was before you had the baby. So you had the baby 2 weeks after that show. Oh my gosh, how exciting. Okay, so tell me, how did it go? What did we have?
A boy.
A boy.
And it was great. I already knew what to expect because it was my second. So I wanted to try to have an unmedicated labor.
Oh, look at that.
And I was able to do so.
What's his name?
Thomas Landon.
Oh, how much did he weigh?
6.15 pounds.
Okay, and how big was he?
22 inches.
Oh my gosh, and how's it going? Are you breastfeeding?
Yes.
Yes?
Exclusively breastfeeding. In the hospital, we did give him a little bit of formula because he had a little trouble going to the restroom, but yeah, since we've been home, it's been exclusively breastfeeding.
All right, and how's he sleeping?
He's sleeping really well. Really? It took him about, I would say, 5 weeks to get to this point, but he's giving me, the least that he gives me is 4 hours, but really it's around 6 hours that I get every night.
Not too bad, doctor.
Excellent.
Exciting?
Exciting, definitely. Definitely exciting. I'm very happy for you.
Thank you.
I'm glad that everything went so well.
That's fantastic. So I want to talk about, labor and what women can expect, knowing the signs indicating that you're going into labor. Doctor, we have a list. So these are some of the things that you may experience in case you are expecting lightning.
Yes, I mean, definitely if you have some contractions, some of the signs of labor, of course, bloody show, if your membrane's ruptured, if you're nesting, any of these signs will definitely be signs of labor. As we know, there's not much difference between false contractions and real contractions, meaning that the false contraction, the only difference is that they disappear after a while the real labor contraction will continue.
Those are the Braxton Hicks ones, doctor?
Those are called Braxton Hicks, and they tend to start around the 3rd trimester, somewhere around 31 weeks or so, sometimes early in some patients, but they happen to be irregular. They're strong contractions, but they are irregular. That's the difference between those and real labor contractions. And of course, you could have a bloody show for multiple reasons, but mainly when you have a severe bloody show is secondary to dilatation of your cervix, and that is definitely a huge sign of labor. Your water could also break, and it could break at different instances. It could break earlier and in premature labor, or could break at term. Sometimes you go into labor before, and sometimes you don't need to break your water out until after you're in labor.
And there's a few more there as well?
Yeah, well, the effacement and dilatation are always signs. Those are the real signs, but those are the ones that we measure in labor and delivery that usually are not being able to be measured at home.
So Janet, What did you experience?
So I delivered him on Friday. Okay, so Wednesday, I started feeling discomfort in the lower back. And I knew from before, okay, this is it. I was convinced that he was going to be here on Thanksgiving because Wednesday evening, I got really strong contractions, enough that it kind of stopped me in my tracks.
How far apart were they?
I mean, we're looking at maybe an hour apart at this point.
And that's a good question to ask you, doctor. How far apart when you realize, oh gosh, I better go to the hospital?
Well, I think that, as she was describing earlier, an hour apart, they're not really significant that should be monitored in the hospital setting. I think it's ideal for you to stay home until they get close to each other.
Close like what?
Well, 10 minutes apart.
Oh, okay.
It depends. Some people at 15 minutes apart should be strong enough that they feel they should go to the hospital. But definitely, 4 or 5 within an hour definitely will be something that you monitor if it's persistent, not just within 1 hour. You want at least 4 or 5 hours of this.
Is that what you experienced then after?
Well, I was trying to compare it to my first labor experience, where it was just, you could tell every contraction was getting stronger and stronger. So that's why when I felt that on Wednesday evening, I thought, this is it. I went to bed, woke up, light contractions, and I spent all Thanksgiving, maybe 20 minutes apart, but then back to an hour apart.
Okay.
Then 15 minutes apart. So, so Friday at around 4 a.m., I woke up and I experienced bleeding. And I thought, well, this is it. So I called the doctor and I said, the contractions really aren't very close together. But, there's some bleeding going on.
Did she do the right thing in calling the doctor?
Definitely. I think the whole point here is that when you feel that there is a question that you have, that's the time to reach out to your doctor or mid-level provider, whether it's a midwife or so, and find out exactly what to do next.
So you obviously went to the hospital.
Yes.
And labor can be different for so many women. So doctor, what is the normal amount of time that a woman, I know everybody's different, but how long can labor go?
Well, there's a difference between prima gravida and multigravida. This is her case. She was also a multigravida, meaning she already had one baby. And prima gravida tends to dilate approximately a centimeter and a half, 1.2 hours a centimeter. While in the prima gravida might take longer than that. That someone in labor could be up to 24 hours in a prima gravida, with the multiparous tend to deliver earlier than that. So it's a different time frame, but we'll use an average. We'll say a centimeter an hour for multiparous and 1.2 for nulliparous.
Jeanette, how long were you in labor?
It was the dilation was very, it wasn't very neat, if you will. So at 1 o'clock, I was 3 centimeters dilated. And at that point, it wasn't very painful, but I thought, I feel like I can go pretty fast, so I don't want to go home. They gave me the option, would you like to go home? So I decided to stay, and we're looking at probably, it took me 2 hours to get to 4, and then another hour to get to 5. But then I went from 6 to 10 in 45 minutes.
Oh, wow, okay. So that
is very common,
normal.
as she was describing earlier. Usually before you get to 4 or 5 centimeters, it's not considered latent active phase of labor. Therefore, the dilatation will take a little longer, as she perfectly signs of took about an hour for her to make it to that. And then once she was in a latent fast track of labor, then it went really quick, especially for second babies. Now, you have to understand it's a huge difference between the first delivery and the second delivery, which is so significant in her case, how fast it went from the 6 centimeters to a fully dilated.
Now, I wanted to read a statistic here that, with you and our viewers. The American Pregnancy Association reports that, I was surprised to hear this, more than 50% of women giving birth at hospitals use epidural anesthesia. So I know you used it in the first one. You chose not to in the second one. Before I ask you that, doctor, why do some women try to avoid it?
Well, it all depends. I believe there is some myth and methods believing that an epidural anesthesia somehow could delay your labor, and some people feel that it was definitely not in their advantage to have had the anesthesia the first time, or some people feel that they would cause her pain or so on. As I described here in early shows, I think the epidural anesthesia is a great tool, especially for premature average patients. You have to understand there's a different situation when this is your second baby, and in her case, her labor progressed real fast, so your time of pain was limited to some people that are progressed very slow and they take a very long time.
Now, Jeanette, you chose not to do any medications. You go, superwoman, you go. How did that go, and what did you decide to do?
So I decided to, the first pregnancy, I came in thinking I wasn't going to have an epidural. I took all these classes in pain management and visualization, but when it came to it, I didn't know what to expect. So when I started feeling the intense pain, I said, that's it, I want an epidural. So the second time I'm like, okay, I know what it feels like. Let me see if I could just take it one contraction at a time. And that worked for me. The hospital, I delivered at Baptist Hospital in Kendall, and they had an exercise, 2 exercise balls. They allowed me to be able to walk around, and that helped manage the pain.
I think we have a picture of you. You're sitting on the ball.
Correct.
So that is what you were using.
Yes, I was using that exercise ball. I just did not look that put together at all.
I'm sure you look beautiful. And this workout ball helped how?
So it helped because I had on headphones and I was listening to, like, you know, belly dancing music, that drumming type of music, and I was just bouncing on the ball, rolling side to side. It just helped distract me. It helped also kind of get my hips feeling like, you know, I don't know, like the movement just helped deal with the pain. And then I also had a TENS unit, which
and
was...
I think we have a picture of that too. It's the TENS machine, or do we have the prop?
Yeah.
Here we go. What is that?
So this is a TENS unit. They use it a lot for physical therapy, where you place the electrodes in a specific spot and then you give stimulation. But this unit is specifically for labor and delivery because it gives you intermittent pulses. But then when you get a contraction, you press the boost button, and then it's a constant, you know, pulse. And it could work one of 3 ways. It could either work because you start using it early labor and it helps your body release those natural endorphins because you're getting that stimulation. They also think it may work because it floods your nervous system. So it's kind of like you're distracted from, you know, the pain. But it could also be a placebo effect.
Exactly.
And I think, you know, if anything, that it helped me just pressing that boost button, feeling in control.
Doctor, your thoughts on this and that ball? I was a little surprised to see, you know, somebody on a ball when they're about to give birth.
The problem with that particular ball, and we use other balls in different hospitals and through the Baptist system we have, is that she is someone that's used to exercising on a ball. She is used to the whole concept of the exercise because there is, and she knows quite well, there's a good possibility of you falling down off the ball if you're not used to it.
And you know, I did switch over to the ones that the hospitals had, because once, you know, the pain started getting more intense, the ones in the hospital, they did help me feel more in control because the shape is a little bit different.
Got it.
So you don't have to, you know, work so hard to find your balance. So.
And how does the ball work, doctor? I mean, how does it help in terms of that?
I think that in general, as she described early, in early labor, because that ball could be used in early labor when your water hasn't broke, that you don't have to be in bed. It helps you. I think the exercise, strengthening your muscles, moving around, I think in general is a good idea. A lot of times I recommend for this to be done at home, because in a hospital setting, because of liability, we tend to monitor patients a lot more. If you could have an external monitor, but not every unit has every one of those external monitors in which you could be out of bed. But once your water breaks, so then you are pretty much committed to the bed. We have what we call bean balls, which is something that allows you to separate and allows for the baby to drop. And it's some of the stuff that we're using to encourage vaginal delivery at the Baptist Health System.
Now, I know, I keep on saying Janet. I'm so sorry. It's Jeanette. One of my best friends is Janet. Jeanette, I know you delivered vaginally. I was reading here, doctor, that 1 in 4 women deliver a C-section. Have a C-section, I should say. I was a C-section. So what are the reasons for that?
Well, I think there are multiple reasons. There are medical indications for cesarean section. There was also the issue with patients wanted to have a delivery at a particular time, so it's an elective C-section. And because of the increased risk of primary C-section, we tend to have an increased level of C-sections overall because of recurrent C-section. Now, as we discussed early in this program, and there is this movement as much as possible to have a vaginal delivery. I have discussed this earlier in other programs and described how important it is to have a vaginal delivery. And I think in her case, Jeanette did an excellent job through the whole pregnancy, because you have to understand it's just not just time in labor what allows you. I think psychologically you have to prepare yourself for that. And not only that, I think that she did a great job exercising throughout the pregnancy, eating healthy,
so important,
maintaining an important diet, All those factors are going to contribute. There's going to be instances in which you have emergency situations that happen. But if you prepare yourself prior to being in labor, that alone is going to significantly help at time of labor so you could have a vaginal delivery.
Absolutely. Quickly, because I have to take a break, but Jeanette, you know, you had a quick recovery too because you had a natural birth.
Yes.
It was nice.
It was a quicker recovery than the first one. But
really?
Because it was the second one, yes.
Right, the second one. Okay, fantastic. We're going to take a quick break, but coming up, we're going to talk about vaginal delivery. Regardless, your body needs to recover after giving birth. So how long does it actually take to recover? Although everybody's really different, right?
Yeah, but I think that we do have a general consensus of how long it takes.
So later on, we're going to talk about setting realistic goals to kick your post-pregnancy body back into shape. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Dr. Sirven or for Jeanette, please call us using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com. We'll be right back.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions, like how much vitamin A is good for you and how much is too much. If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good,
Others not so much.
But that's life.
It's when something doesn't seem quite right
that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Awkward. I'm the awkward silence. You try to avoid me, then there I am again.
But an awkward silence can be a great thing.
Like Kelly here is about to demonstrate.
You haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, OBGYN at South Miami Hospital and West Kendall Baptist Hospital. Also joining us is Jeanette Janero. She's a fitness expert, the owner of the Naked Formula, and she gave birth to her second child just 8 short weeks ago. She's looking fabulous. And if you have a question for Dr. Sirven or Jeanette, please call us using the toll-free number 855-796-4475. Okay, so here are the facts. When you have a baby, your body changes. And after you have a baby, well, your body changes. Again. So the same way a woman takes care of themselves during pregnancy, the same should be post-pregnancy. Is that correct, doctor?
Definitely. I think it's most important to take care of your body after you deliver. And I think that Janero will probably give us great tips on that. But I think one of the best things that you could do to help your body significantly improve, and not only that, but to help your baby, is to breastfeed. Yes. I think that's going to help significant the health of your baby and also help your body come back to form as fast as possible.
I couldn't believe how much weight I dropped after breastfeeding. It was like, woof. And I actually went down to 90 pounds, which I think is ridiculous because I breastfed so much. But it really works. It really does get you back into shape quickly, right?
Yes, certainly.
So what have you done to start recovering?
So let me break it down week by week. The first week, really, it's just about surviving. Go to sleep when you can. Week number 2, just focusing on the posture. But then it really wasn't until week number 5 that I worried about, okay, let's get the junk food out of the house, all of the sweets and treats that, the guests brought over, let's get it out. Focusing on my posture and tucking in my core those early weeks. And once I hit 6 weeks, then I could do light exercise. I still walked before, but once 6 weeks, that's when I got the clearance.
And we're going to go into more detail in our next segment about great tips that you can do at home, just like Jeanette is doing. Now, Doctor, C-section, I experienced it a little different.
Yeah, well, definitely with a C-section, your recovery might take a little longer than with a vaginal delivery, but that does not mean that, I think I've mentioned a huge story that I have an interesting patient that did it sit-ups right after.
Oh, you told me this story. It was fantastic.
Back.
Tell our viewers, it's great. Listen
so
to
this is an older patient that was really crazy about exercise, and she delivered, unfortunately, by C-section. She really wanted a vaginal delivery. And that night after the delivery, the nurse called me that they found the patient doing sit-ups on the bed right after the C-section.
Right after a C-section?
I had never seen that, and I could never even imagine that was possible. So I rushed to her room, and I told her, what are you doing? Are you crazy? And she's like, I know my body, I have gas. This is the best way to get rid of it. So, I wouldn't advise that to anybody, but at least let me know that if you do a sit-ups right after a C-section, your stitch is not going to rip open. But, it's a true story that I had to go through it. But the truth of the matter is that I think that ideal, whether you have a vaginal delivery or a C-section, I agree with Jeanette, the first 2 weeks are important to just take it easy, spend time with you, get used to the fact that you have a new member at home that is demanding a lot. Okay?
It is.
It's demanding a lot, and it's demanding a lot not only emotionally, physically, but from every aspect of you. Plus, it creates a strain in your family. You had another baby, you have a newcomer at home, you have to have the older baby get used to the idea of having more members in the household. So it's a lot of things. But then after third week or so, I think it's time to start looking at yourself, making sure you start by walking, doing some type of light exercise that helps you get into shape. There's a lot of misinterpretation with C-sections. Yes, it takes a little longer to recover, but that does not mean that you cannot get back to doing exercises right after 2 to 3 weeks. Light exercises, which is what's recommended in general, until you get at least to 5 to 6 weeks. And at that time, whether it's a C-section or a vaginal delivery, it really makes no difference. You should be able to increase your level of your exercises. You should be able to, especially what you said earlier, reduce your food intake. Take away all those fat in food that's really not going to help you.
Now let's talk about the emotional aspect, since you mentioned a little bit about it, Doctor. There's postpartum depression. When does that does it kick in with everybody? Has it kicked in with you? How do you feel that?
So they explained to me that you can, every woman may experience baby blues, but then there is a postpartum depression. So the first pregnancy, I came home and I was just crying all the time. I couldn't help it, crying all the time. After like 2 weeks, that went away, and then I didn't feel any other signs of depression. This time, I don't know if it's just been too busy with a toddler as well, but I haven't been crying like that.
I think she described earlier the difference between postpartum blues and postpartum depression. I think that in majority of patients, there is some type of evidence of postpartum blues. And the postpartum blues, as she described earlier, is that feeling of overwhelming you start crying for no reason. You have no idea what's going on. So, somehow you just feel uncomfortable. You start worrying about not being able to take care of your baby, and all those issues. They're all part of the postpartum blues. But when we talk about depression, there are completely different signs, and of course they're prolonged time. They take away longer time. They don't recover. They are associated with not wanting to eat, not wanting to take care of yourself, not wanting to take a shower, sometimes even wanting to hurt your baby. So I think all those are definitely signs and symptoms of postpartum depression that should be looked into.
There's something, doctor, called pelvic floor physical therapy. What is that mothers can do after giving birth?
Well, I think that any type of exercise to strengthen your pelvic, whether it's to your Kegel exercises or any of those exercises, are going to be so important for you. Now, the majority of patients in the first week or so are not too concerned about it, but there are some issues and some patients that develop some pelvic diastasis, in which there's a separation, so your pelvic, which is a very painful process, happens usually in a normal delivery, and those patients need pelvic therapy right away, so we could get those bones aligned back together.
He said Kegel exercises, and I started doing them. Did you?
I didn't.
It's like he says, oh, wait, hold on, pelvic floor lift.
Are you doing that, by the way? Do you do them?
Oh, yes.
You really do?
Definitely.
That's so funny.
Especially when I'm nursing, because you feel you feel contractions, and it reminds me, oh, lift to the pelvic floor.
Look at that. And how does that help, doctor, just out of curiosity?
In general, remember that the vaginal walls are laxative secondary to the hormones and allowed for the baby to come through the birth canal. So all that muscle that has weakening, not really weakening because of anything, but because of the hormones and everything allows for the baby to come down, has to get strengthened. So that strengthening, the exercise will help significantly with that. And as she described early, those contractions of the uterus, remember, oxytocin is produced by the milk, which is the same hormone that is given to patients to go into labor. I mean, instead of giving oxytocin, you would do breast stimulation, would be the same. When we used to do a oxytocin challenge years ago, it was produced by breast stimulation, not by giving oxytocin. And those are going to cause contractions in the uterus, which you're describing, which is breastfeeding. She's going to feel exactly the same contractions. I'll remind her to go ahead and do her exercises.
All right, I know we have a family picture of all four of them. How was the introduction of baby with brother?
Oh, it was great.
Yeah.
It was great.
How did you go about it?
I had been telling him, okay, baby Thomas is going to come out. So we brought him into the room. He looked at the baby and he immediately looked at my stomach like, wait a minute.
Did it come out of there?
Yes.
And how old is the eldest?
2.5 about.
Oh, that's fantastic. So he's enjoying and having a good time.
Yes.
That's fantastic. That bonding experience is so special, isn't it, doctor?
Right, but don't ever get disappointed. There's a certain instance in which the older baby will get a little jealous, and that doesn't really mean anything. And we have to understand that they are going through an adjustment themselves. And sometimes they're going to have a great time, and they're going to be loving every minute of it, and some other times they're going to feel distressed by the whole situation.
All right, we're going to take a quick break, and as we take this break, we will be doing our Kegel exercises, so we want you to do them as well for just a couple minutes. It's really good at any age, right, doctor?
That is correct.
And men can do it too, right?
No, that's not as adequate. But
Coming up, we're diving into, oh goodness, setting realistic goals when trying to get your body in shape post-pregnancy. We'll also talk about what to expect the first 3 weeks after pregnancy when we return. Are you doing them?
Yes.
Okay. You're watching the Health Channel, All Health, All the Time on South Florida PBS. If you have a question for Dr. Sirven or Jeanette, please call us using the toll-free number 855-796-4475. Remember, you can take the Health Channel wherever you go. Visit our website. It's fantastic. allhealthtv.com. You can watch the Health Channel live 24/7, and you can watch videos just like this one in the future. We'll be right back.
This is my kind of happy hour.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians, so you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
Every year, millions of Americans are exposed to a contagious virus.
What is this virus? It's stigma. Stigma promotes an environment of shame,
fear, and silence,
which prevents millions of people from seeking help.
But there's good news.
The National Alliance on Mental Illness believes stigma towards mental illness is 100% curable.
So do yourself and everyone a favor.
Go to curestigma.org and get tested for stigma.
Us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The Y fills the gaps and bridges our divides. Support your local Y today. Because where there's a Y, there's an us.
There's a better way. With Baptist Healthcare on Demand, you can see a Baptist physician from any mobile device or PC anytime from anywhere.
How can I help you today?
Oh, hi. Go to baptisthealth.net/care on demand to enroll for free today.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, OBGYN at South Miami Hospital and West Kendall Baptist Hospital. Also joining us today, Jeanette, Janero. She's a fitness expert, the owner of the Naked Formula. Love that name. And she gave birth to her second child just about 8 short weeks ago. If you have a question for any of these two special guests, please call us. There's a toll-free number, 855-796-4475. So this hour we've been talking about labor and delivery, and so often women expect to immediately lose all the weight they gain, but it's more about staying healthy after delivering than it is about dropping the weight. Would you agree, doctor?
100%.
And why so?
Because it's really not, the weight itself, even though ideally you want to drop it, I think the most important thing is to organize yourself and to be healthy. It's, you know, it's not just a weight issue, it's a psychological issue that gets involved at the same time.
And do they get a little frustrated if they come into your office and they say, you know, I haven't dropped the baby weight, it's frustrating me?
Well, I think they do significant. I think that, you know, there is a lot of issues that are going to happen right after you deliver your baby. And I think for women in general, it's very important to get back to that same figure that they had before. And it's important to get it back as soon as possible because emotionally, that is significant.
Right, and it's really not a sprint. It's a kind of like a marathon. You got to set realistic goals. I know, Jeanette, you did, and we have some goals that she had post-pregnancy, so let's show our viewers in case you are expecting. Week 1, rest when possible, walk. That's a great idea.
Yes. So I felt comfortable walking. I went ahead and did so, but I was so tired with, you know, nursing every hour and a half, 2 hours.
Oh, yeah.
So I really did not set exercise as an expectation at that point.
Week 2, focus on posture, engage pelvic floor.
Correct. When you're nursing, and even, you know, if you're not nursing, your shoulders are pulled forward, you're looking down at this precious baby all the time. So you have to remember to, like, you know, correct your posture. Otherwise, you're going to get a lot of neck pain.
All right. Week 3, wake up the abs.
Wake up the abs, transverse abdominals. I felt very uncomfortable even sitting up out of bed with the top portion of my abs were very sore, but I would always tuck in the pelvic floor and pull in the transverse abdominals. So I would hold, it would be like an isometric exercise. So kind of like what you do with a plank, but sitting up.
Oh, nice. And doctor, they really do say that when the baby is sleeping, you really need to get some shut-eye because it's necessary for your body to recover too. Definitely.
I mean, I think it's very important that you understand the importance of resting. I think you know, a good night rest is ideal for anyone, but in particular for women that don't have a particular set time because you don't know when that baby is going to ask for it to be fed. So try to get as much rest as possible whenever it allows, especially when your baby's resting. Try to sleep and try to get all that energy back.
And I'm assuming when your body's gearing up for the milk production, it's really not a great time to think about, you know, diet right now.
Well, I think that there are certain things that help you make milk production, especially the fluid intake will definitely increase your milk production. Now, you have to understand that a lot of the fat food and all those things not necessarily are going to increase your milk production. And, you know, I think it's very important to understand that, yes, there are certain goals that you have to do, and there are certain parameters that you have to make, but you also have to be conscientious of what you're eating, not just prior to pregnancy, but the same way that you were concerned right prior to pregnancy, you have to be concerned right after delivery.
We actually have a side-by-side photo of you, and it kind of shows a comparison. I want to show it to our viewers and tell us why you took the picture and, wow, look at that difference. Look how cute that is. I just can't. So cute. So that's you just about how many weeks to the left?
So to the left, I am 39 weeks. That was that was on the Wednesday that I started feeling the contractions. That was like 2 days before actually delivering. And then the baby is almost 2 weeks.
Okay, wow, so that's pretty good. That was 2 weeks after. Breastfeeding, again, I'm going to tout about it because it's just so amazing. It really does help bring down that tummy, doesn't it?
Correct, because it's helping the uterus go back into its normal shape. Every time you're nursing, you feel the uterus contracting, and that's helping it naturally get back into shape.
And you mentioned that, let me interrupt for a second.
Of course.
Because we live in a Latin community, and everybody thinks that they need to have a faja. So everybody
How do you
thinks
say faja in English? Like a girdle?
Yeah, a girdle.
A girdle.
Yeah, a girdle. And everybody wants a girdle right after delivery. Let me explain to you that necessarily the girls are not going to get you back into shape, okay? And your uterus needs a certain time to get smaller and get back into the pelvic cavity, because remember, this uterus normally is located inside the pelvic cavity. For you to have a baby, this uterus has to come out of the pelvic cavity, gets into your abdomen, and you can't expect that uterus to go involute itself right after. It takes a little bit of time. So, and that usually takes about 6 to 8 weeks for the uterus to go back into space, in the correct space. But the majority of Latin people, the next day they deliver, they want to have a girdle placed on them.
You know, it's not called girdle anymore. What's that new?
Waist training. Waist trainer.
Waist trainer. But I get it with the girdle.
Okay.
Ponte una faja.
Exactly.
Rápido.
Everybody wants a faja. And they even want a prescription for the.
Oh my
So, I mean,
goodness.
it is not ideally, even after C-sections, because remember, when you have an abdominoplasty, that is a surgery which goes from hip to hip, and of course it has to tuck you in. So those patients need a surgery girdle in order to tuck in and to create that. But when you have a C-section, your incision smaller, your uterus still large, so that girdle is not going to help you to bring that uterus back into place. But the minute after this, the day after C-section, all those patients want to have a girdle right after that, which I personally don't think is absolutely necessary.
And they ask you for a script?
Oh, they want it. They want it right the next day. Make sure they give me a prescription for a girdle. A lot of people really believe this is going to get your body into shape. Not, I'm telling you, it's not going to get your body into shape.
Oh gosh, that's so cute. I love it. Okay, wake up your abs. Tell me again how you do that. I mean,
something as simple as, you know, let's say you're in the car. You're not holding the baby at that time. Okay, let me roll my shoulders back, lift the chest, and then tuck in. So you think about
we just did that, you and I. Dr. Sirven and I.
Oh, we just have to get in shape. Or we're like, oh my God, I'm just.
Yeah. So you wake them up by trying to put your belly button back towards your spine.
You doing that right now, Dr. Sirven?
I am. Might not be able to breathe again, but I am doing it.
Those are things that we should always be doing. But that's a great idea. And you're driving and you're using a little bit of exercise while you're driving.
Exactly. You're just like waking up those abs. And it helps, you know, as you mentioned, the uterus is getting back to where it's supposed to be. So giving those muscles a nice strong structure helps those organs get back into place.
All right. What other suggestions did you have regarding just, you know, things that we could do that are easy, that are not too, you know, difficult?
Flexibility. Work on your flexibility. Your body was just, you were just holding yourself differently during a pregnancy. Then you had a baby. Then, you know, you're just constantly hunched over. So I felt like my pectoral muscles were really tight. The front of my shoulders were really tight. My quadriceps, hip flexors. So if you want to feel like you're doing something, stretch. Even though you're not ready to load your body with that type of, you know, heavy resistance training or intense cardio, stretching, you'll be doing something, and you'll also be helping getting your body back into that proper form.
You know, now that you mentioned, I think stretching in general is one of the exercises that we should do more often that we don't.
Agreed.
Yes.
I think that a lot of us, if you look at the Oriental culture, they're very much inclined to that stretching, and the older Oriental culture tends to do that stretching on a daily basis, just for about anything. And most of us get out of bed And the first thing we should do is to be stretching, but we never do. So stretching.
Who has
in
the
Indiana,
time?
but you'd be surprised. I mean, those people make it a habit of certain things.
That's important.
And it's important. It's
it could
important.
be 5 minutes.
It could be less than 5 minutes. It could be 3 minutes, but it's something that you do. And I think it helps significant through our whole life.
All right, we're going to take a quick break, but real quick, doctor.
The posture.
Posture. Stick in that stomach.
Definitely.
Okay. Do a Kegel exercise.
That's for her or you.
We're doing all these things during the break. This is too much fun. All right, so coming up. I'm giggling too much. Similar to a house that it needs a foundation to build on, so does your body, starting with stretching and flexibility, which we just talked about. So this is key to getting your pre-baby body back in a safe way. So stick around. We're going to show you some stretches to help improve your flexibility when we return. And when does the doctor give you the green light for more vigorous workouts? And you know what else? Dr. Sirven shares us his thoughts on that as well. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for the experts, please call us using the toll-free number right there, 855-796-4475. And don't forget to check out our website, allhealthtv.com, where you can watch the Health Channel wherever you go by visiting that website. And you can also watch previous videos just like this one in the future. We'll be right back.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful. And why should you go anywhere when you'll probably feel better just staying in bed anyway? That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home? And it's care right away, not hours of driving in the car and then sitting in a waiting room. Because when I have the flu, there's only one thing I feel like doing.
Us lives here, where we can find common ground, big enough to dance on. For a better us, support your local Y today.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
This is My Kind of Happy Hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, OBGYN at South Miami Hospital and West Kendall Baptist Hospital. Joining us also is Jeanette Janero. She's a fitness expert, the owner of the Naked Formula, and gave birth to her second child just about 8 weeks ago. If you have a question for any of these two special guests, please call us using the toll-free number 855-796-4475. We would love to hear from you. So, you know, the saying goes, start small, but think big. We're not talking about business here. We're talking about a successful post-pregnancy goal plan. So, doctor, how often do you need to remind patients that, I guess like Rome wasn't built in a day?
Well, I think it's so important. I think in general, what you want to create is this ideal goals and reach your goals, but realistic goals. Otherwise, we're just not really obtaining nothing.
And I'm glad you brought up realistic goals, because Jeanette has great realistic goals, and now we're going to target the 4th, 5th, and 6th week. So let's first talk about the 4th week flexibility. We have a video, I think, of you here using a foam roller. Let's see if we can roll that real quick and explain to our viewers what a foam roller is and how it helps. Let's see if we could take that anytime soon. Do we have it? There we go. So tell us what you're doing here.
So a foam roller, you could use it to roll out your knots, but this is a great way to use it to help decompress your spine. So you place your head on one end and your tailbone on the other, and then you just allow your arms to open up. This opens up the chest, decompresses the spine, and then you can make it a little bit more intense by even placing your hands behind your head, and it just opens up the shoulder a little bit more. But when your kids give you like just a couple seconds to yourself, I keep this next to the couch, and it really helps open up the chest, get your head and your neck back into a proper position too.
I know you brought one here. Can you grab it? It's really cool. They're really fantastic. My kids use it a lot to dance and roll out their bodies, and it seems like
Don't
really.
hit me with that.
I'm not kidding.
Intention.
I'm not going to hit you with this, but they're really tough. You can also roll out your legs.
Correct.
It really just helps muscles. And again, doctor, we talk about, and this is so economical. This is a great buy. I suggest it to everybody. When I go running, I tell my kids, roll me out. Flexibility, you talked about that.
It's so important. Flexibility in general is not going to be something that you are going to use just while you're pregnant, but I think throughout your whole life. I think maintaining that flexibility, if your muscles get contracted, then you're going to reduce that flexibility forever. So a lot of people that believe in weight-bearing exercise, and I think that if you don't incorporate flexibility into any type of exercise, you're going to do damage to your body overall as time progresses.
Right, and if your legs hurt, I think it's just really great. Pretend these are my legs, right? And you just kind of roll, and you feel it right there. I'm even feeling it in the back of my arms. I just love this kind of thing. And it really releases endorphins and all that. Do you feel that too?
Oh, I do. I love it, because when I'm doing it, after I'm done, you see my 2-year-old copying me. And
how cute is that? Doctor, do you use this?
I personally don't use this. I have one at home.
You do?
I personally don't use it.
Why don't you use it?
I'm going to start using it now.
Yes, we're going to do all that posture, Kegels, and foam rollers.
Okay, I'm going to start
doing
My goodness,
we have a list of things to do today, don't we? Okay, the next one on her list of goals was, I think, week number 5, and I believe, if I saw it correctly, was diet. Can we bring that up again real quick? Was it diet? Maybe I'm wrong. Nope, there it is. So talk to me about your diet.
Week number 5, all the junk food out of the house. As I mentioned, guests, they bring in a lot of sweets when they meet the baby, but all of that out of the house, and I focused on making sure that I'm getting enough healthy fats. The carbs that I'm taking in are going to be those complex carbs like the brown rice, and also making sure I'm getting enough of the lean protein.
Okay, and doctor, there are a lot of foods that can help also with that postpartum depression, right?
Well, I don't know about the postpartum depression in general to have a particular food that I am aware of, and that I don't know a particular
Or the
food.
risk of getting it, let's say.
Of risk of getting it, yes. I think that if you are, there are certain foods that if you take them excess amount of it, I think it's going to significant effect of it. But I think what she's mentioned early, the lean fat, I think is going to help you, maintaining a healthy fiber diet, all those things are, and like I said earlier, make sure you are increasing your fluid intake, because that would definitely help with milk production.
True. And week 6, doctor, 6 was a second postpartum checkup?
Well, it depends on every physician has a Usually they come 4 to 6 weeks, and it's been shown now that you don't have to have a set standard as far as a set day for a postpartum visit and a vaginal delivery or the C-section. It's really when the patients feel comfortable, as long as they come into the office. There are certain things that you want to discuss at that time. Usually they discuss, see how things are going, but especially you want to find out whether there are any signs or symptoms of postpartum depression. So I think that if you have that between 4 to 6 weeks, you'll be able to catch that. And also then discuss possible method of birth control or other conditions that I think is important, and it's very important to have that postpartum visit.
And you mentioned birth control. Women are really fertile after they give birth, aren't they?
Well, women are fertile overall, I'm saying. But,
no, but they're really.
Well, you have to understand that it's difficult to know exactly when your ovulation is going to happen. Because remember that you just delivered and we don't know exactly when ovulation is going to happen. So a lot of times patients tend to be fertile without knowing exactly when they are. There's not a way that you could plan as is in the 14, 15 days right after your cycle. So that's definitely a condition. But you have to understand that when you're breastfeeding, less likely you're going to be ovulating, so you're going to be less likely to be fertile after that. And then, of course, there's a huge question, when can I have intercourse right after delivery? And I think it's so important, depending what type of delivery you have had and whether or not you had an episiotomy or there were stitches or so on. There's not really a particular time in which you should or should not have intercourse, but I think it should be when you start feeling comfortable and you make sure that you didn't have a laceration or something that could somehow be damaged right after intercourse.
Couple quick questions. When is a woman cleared to do vigorous exercises after natural birth?
Well, I think in general, what she described earlier, right after the third week, I think this will be ideal. I mean, and as far as vigorous exercises, it has to do with your level of training. Okay, if you weren't exercising ever before and you just gave birth, don't expect to do vigorous exercises right 3 weeks after you deliver.
Exactly.
I think that you have to get in shape in order to make sure that you are able to do those exercises.
I know you do a lot of Zumba now. I think we have some pictures of you doing some exercise. So tell us what your activity level is.
So in the morning while I'm making the coffee, I put music on and my son and I, we start dancing. This is a great exercise I'm doing for my glutes.
Those are kickbacks?
Yes. So I am, pushing hard off the floor with my foot. That way I get some resistance with the glutes. And there goes my son running in the shot.
That's so cute.
So those are the type of exercises that I'm doing. For cardio, dance, 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 dance.
Okay.
I started off by saying, okay, I'm going to keep moving for 3 songs and then 5 songs. And then that way you just kind of don't think about it as like a time thing. And then for the resistance training, upper body, I'm not doing anything because I'm feeling a lot of tension in my neck and my shoulders from carrying the baby. So I'm focusing on lower body, and those kicks are great.
I think we have a photo of week 1 versus week 8. If we could take that. Oh, wow, look at that.
So you were mentioning about the uterus going back into place. You could just see right there how like my belly's still popping out, and that's, you can't get discouraged because you have an organ inside that's larger than it normally was when you're not pregnant. And then you can see how naturally it just starts going down with the help of breastfeeding and tucking in your core.
Yeah, that's right, tucking in the core, which I'm doing it right now. She looks fantastic.
She looks great. She looks great. But I think it's so important. Jeanette is a perfect example of someone that not only took care of herself prior to delivery, but right after delivery. I think that what you described earlier, this is a lifetime commitment. I think that doing exercise and eating a healthy diet is so important for all overall. And of course, not all the time we're going to be great at it, but I think if we commit ourselves to maintaining that and keep in the back of our mind, I think we'll be able to be successful at it.
And honestly, I think it's also about setting realistic goals that are good for you. I mean, baby steps, no pun intended here, but truly, doctor, baby steps, and everybody's different. Just because maybe, Jeanette was able to lose all that in 8 weeks, it might take someone, it's okay, it takes you a little longer.
Right, and there's nothing wrong with it.
Right.
There's nothing wrong. And you're never too late to start, which I think is so important in life, because I think that even if you have had a certain, if you have issues with weight gain and you have all the things, it's never too late to start.
Absolutely.
I think that what you do have to do is create yourself, ideal goals and realistic goals, and that's the way to be able to succeed.
All right, we can't end the show without showing the beautiful picture once again of Jeanette with her husband, Mommy and Bobby, and the 2 lovely children. We've got Antonio, the 2-year-old, and of course, baby Thomas, who was blessed and came into this world. What a gorgeous picture. Of course, I have to ask you before we leave. I mean, it's the obvious question. Are you going for the girl?
Oh, we haven't ruled it out. Oh. My husband, in fact, the day we came home from the hospital And I sat down on the couch. He like made sure I was comfortable, and he said, I have to make sure you're really comfortable so you can do this again. So, yeah, we haven't ruled it out.
There you go. There you go, doctor.
Pleasure to be here with you.
Gracias. Thank you so much for coming. God bless you.
God bless you.
Thank you very much.
And of course, when you get ready for that third one, you come back and talk about that third experience, huh? Third one's a charm, or it's usually the oops. Okay. Thank you so much for joining us today on the Health Channel. Remember, it's all health all the time on South Florida PBS. If you like social media, I'm not really crazy about it, but if you like it, follow us on Facebook and Twitter. We're there for you at All Health TV. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. That really is fantastic. You can watch the Health Channel 24/7. Lots of videos there of so many things that you would be interested in. Check them out. I'm Olga Villaverde. We'll see you next time. You take care. Congratulations again.
Thank you so much.
Right.